we have a widespread audience, which is exciting. My name is Phil Collins. I'm the program manager here in WA at CareerTrackers. I've been with CareerTrackers for the last year. My background has been in education, but has worked very closely with the healthcare sector. So definitely have a appreciation and respect for this industry, and something I'm very passionate, as it closely does align to education as well. So yeah, really excited to have the group here today, and really excited to get into the session. And you know, we'll try and make it as punchy as possible, and some elements of interactive engagement, but also we've got, you know, two great speakers which I'll introduce in a moment. So, just letting a couple more in, excuse me. Yeah, look, we'd just like to begin with an acknowledgement. I respectfully acknowledge the owners of the land in which we're meeting today, the Whadjuk people of the Noongar Nation. It's a privilege to be standing on this country. And I'd also like to acknowledge the traditional owners of the many other lands we have represented here today. We pay our respects to elders past, present and emerging from all of these regions, and yeah, exciting to have engagement from lots of people from across Australia. So welcome to a couple more people that have joined us. Please enter your details in the chat, really trying to capture a little bit of the audience and see that wider representation from around our country. I'm going to talk through the agenda briefly because really keen to get into our session today. We've got a couple of introductions, and I'll walk through some key points, and then I'll ask them to briefly tell a bit of their own background. Going to have a discussion around the profession of healthcare. Why is it important, and perhaps where is it starting to shift, particularly now with some of the challenges of COVID, but going into the future. Want to share some conversation around barriers to success, but also how do you overcome those barriers, whether they're barriers within yourself or external barriers. Keen to capture, I guess, what we call ingredients for excellence, and some of these ingredients will align to the graduate skills and capability framework that you should be familiar with for most of you, but also piggybacking the knowledge of our guest speakers. What have they seen that's worked well? What have they done that's helped them succeed in their career? And then sharpening the focus back to you as students or interns. How can you accelerate this success? You know, what are some things you can do, you know, within uni, within your internship, within the CareerTrackers community, but also your wider community that will help you be best prepared for a successful career in this industry. So that's the agenda today, and yeah, really excited to have you all, and we'll get into it from here. So, two really exciting speakers today, our special guest, and we're really excited to have Kerri Colgate here. She is the director of her own consulting firm, but our relationship with CareerTrackers stemmed from her coordination at Midland St John of God Hospital, where she was the Aboriginal Health Coordinator and has taken a number of interns, but also been a really great support of the program. We've got an alumni with us today, Josh Preece. Thank you for joining us. He's a graduate doctor at Royal Melbourne Hospital, so certainly is in the thick of things with the challenges with COVID. And as you can see, he studied a couple of different degrees and has interned at a number of different companies, and quite interesting to see his journey because he started more in the business area and has progressed now into a little bit more of a passion piece for him. So without further ado, I will ask Kerri to give us a brief introduction of herself and her background, and then we'll follow with Josh after that. Welcome, Kerri.
Thanks, Phil. And hi everyone. Thank you for inviting me today. I'm very privileged and excited to share with you my journey, I guess. But yeah, so welcome. The protocol for introducing oneself to Aboriginal and Torres Strait Islander people and non-Aboriginal people is to provide information about one's cultural location so that we can make those connections and they can be made on political, cultural and social grounds, and relationships can be established. So following this protocol, I introduce myself within this space. My name is Kerri Taylor, Colgate. I belong to the Balladong Wadjuk clans of the Noongar Nation on my mum's side and the Amangu Yuit on my dad's side. I'm a mother of 2 adult children and recently became a grandmother to identical twin girls who are now 5 months old, and been married to my partner of 34 years. I was born in 1971, a time when policies and acts were recently removed to include Aboriginal and Torres Strait Islander peoples as citizens. However, for my 2 brothers who were born in 66 and 67, were unfortunately born as flora and fauna. And I encourage you all to maybe do a little bit of research around what flora and fauna was back then for Aboriginal people. I grew up in a small wheat and sheep town called Three Springs, which is located about 320 k's north of Perth. I spent 33 years living here. Completed my high schooling in year 10 at a high school 22 kilometres up the road. I then moved to Perth at the age of turning 16 to move with my mum. I completed a year at business college doing secretarial duties. I then moved back to Three Springs to be with my dad and obviously my husband today, who is here today, sorry. I had my first child at the age of 18, which is really quite scary for me and you know, obviously it was very young. I then had my second child at 21. And then 6 months after I had my second child, I was contacted by the local doctor in town there at the doctor's surgery, and he offered me a position as a receptionist working there. For me, this was a bit of a game changer because I knew I had very limited skills, very limited qualifications. So to this day, I'm eternally grateful for him, offering me this opportunity, because from there I only excelled. I spent 10 years working at this surgery and then became practice manager in the last probably 3 years. So, and for me, that was, a big highlight. Within that time, I also was able to complete a business administration traineeship that AMA Services offered me, which also included a medical terminology course. This absolutely just heightened my understanding further around, the importance of health. So in other words, my health literacy really increased tenfold, and which is really important because, as we know, to transfer those messages out into the community, out through our own kinship systems, is absolutely critical to ensure, that we are aware of how bad chronic disease is within the community. My dad died in 2001, which really had a huge significant impact on my life. I then moved to Perth in 2003 with my 2 girls. I stepped straight into the family business, which was Indigenous Employment Services, and this was really quite daunting for me after spending 10 years working in the health sector. Even though they do have similarities when it comes to those social determinants, because we do know how important it is to get a good start in life, to have education, and to have employment to really succeed and do well in society today. I spent 3 years doing this and realised it wasn't for me. I was pining to get back into the health sector. So I did a hack role working in the community, just helping out aged care, before my mum then knew that I had too much to waste, and she taught me into going to university, which was really, really quite scary. But I took the challenge up. Being a mature age student, I guess you do have that little bit more of confidence, a little bit more wisdom, I guess, to take on such a challenge. So I completed my undergrad degree at Curtin University, doing a Bachelor of Science in Indigenous Community Health. And again, you know, this course not only developed me professionally or personally, but more so really culturally, and the importance of being really culturally grounded and really culturally strong when it comes to working in that sort of dominant space, and being able to bring that to you know, work in that liminal space. I then sort of, you know, I've also got extensive experience working, you know, across a number of other, you know, variety of roles such as research, health promotion, and Aboriginal programs. I've worked in government and non-government health services, where I've managed a lot of sort of small and medium projects. One of the, I guess, biggest jobs that took me back was working with the Medicare locals, and I'm not sure if many of you are aware of who they were, but it's a primary healthcare area, and it gave me the opportunity to get back into the GP land. I knew I was very passionate about this, and this is where I do my best work, and I thoroughly enjoy it. So with this role, it's you know, I had to get out there into the surgeries or the practices in the local government area that I was working in. In this case, it was the city of Swan here in Perth, around the Midland area, which also has a really high population of Aboriginal and Torres Strait Islander people. What I learned along the way was, you know, how concerning it was, the number of GPs that had very limited understanding of the Closing the Gap initiative. This was really frightening for me to know, you know, that a lot of Aboriginal people and Noongars were accessing these practices, however, missing out on those Closing the Gap initiative and how that can support them really quite well. So alongside that, it was also an opportunity to provide that cross-cultural education, you know, to make practices really culturally friendly, secure and welcoming, because the last thing we want people to do is start accessing ED for those primary healthcare issues. The Medicare locals then closed down, so I was fortunate then to move on to St John of God Hospital in Midland. I started out as the Aboriginal Engagement and Culture Advisor, before then being successful in the Aboriginal Health Coordinator's role. I spent 4 years here at Midland at this particular division, and it's where I then learned and encountered the CareerTrackers program. It was really exciting to learn about this program and to know the number of medical and sort of health practitioners and professionals that are coming through. And I applaud you all, because, you know, through my journey and experience working in many of these sort of different areas and settings, we had very, very low numbers, and it's really quite, you know, worrying in terms of being able to support our Aboriginal community out there in getting the best culturally appropriate care at the right time as well. So, you know, I think from memory, we had about 9 students that came through our service, because they were specifically placed within our Aboriginal health team. Over time, you know, I didn't want your skills as students to go unnoticed or wasted. It was really important to, you know, an obligation of myself to really get the program embedded in the hospital in a way where it could make you shine, where you could really, you know, learn a lot more around your particular discipline or your study area. And it was really embraced over time. So, you know, not only did students learn about the pivotal role that our service played within the hospital, but they were also able to apply their own skills and study learnings, I guess, as well across those particular areas across the hospital. So just quickly, so prior to me finishing up this year at the hospital, due to my daughter having twins, so I knew that I had to stop work and help her with my beautiful granddaughters. I, along with my mum, who I'm very fortunate to still have with me today, we started up our own consultancy service called Noongar Consulting. We specialise in disability support, capacity building and cultural consultation. And you know, it is my mum that I have to acknowledge. She is the one that I have had all my learnings and my teachings from. And it's really important because as an emerging elder, I have to carry on that legacy and be able to carry that down for generations to come. One thing that my mum has taught me is not to be afraid to speak the truth, particularly in that dominant feminine space as well. I also acknowledge my grandmother and many of my aunties, many of whom have passed. But, very fortunate, like I said, to have my mum of 72 years of age with me today, who still works part-time in that disability sector as well. But she continues to inspire and teach me the importance of life. So I'd just like to finish off also, just to add on with Josh's acknowledgement, but also to acknowledge and thank those ancestral spirits of our elders from all the clans that cover this beautiful country that we all gather upon today. So thank you.
Thanks, Kerri. There you go, Josh. Tough luck to follow, mate.
Yeah.
Welcome, Josh.
Hi, everyone. My name's Josh. I grew up in Rockhampton on Durrumbal land, but I'm Wiradjuri and Torres Strait Islander. I, as an undergraduate, studied a Bachelor of Laws and Bachelor of Economics at the University of Queensland, and interned at a few different places through CareerTrackers at that time, mainly through in finance and property, which is something I was very interested in at the time. And I learned a lot of really good broad skills, which stood me in good stead. But towards the end of my degree, I realized that I wanted to do something a bit more hands-on, and I'd been interested in the health space for a long time. A lot of my family, although we didn't have any doctors in the family, a lot of my family had worked as nurses, a dental assistant, a physio, so we had sort of a bit of a health background, and that had been something that I've been thinking about as well. I was also quite involved in the Indigenous Student Collective at uni as well, which I'd strongly recommend you get involved in if you're not already, just because although it's a great social hub, it's also a great mechanism to make sure your voices are getting heard on the things you care about on campus. So after I graduated from UQ, I moved to Sydney and studied a Doctor of Medicine at the University of Sydney. And then this year, I'm now a first-year doctor at the Royal Melbourne Hospital, which is an exciting time to start a career in a hospital. And for those of you, I was reading through some of your sort of bios in the chat there, and it's worth looking into sort of as you move towards graduate roles, those of you who are looking to work in hospitals, sort of what the support is for Aboriginal staff as well, because some hospitals are sort of really ahead of the curve and really good at the support they offer, and some are just getting started, and some sort of don't have too much in place. And that's important to know, I think, when you're going to a workplace, what the sort of level of support or is for Indigenous communities before you sort of make up your mind about whether that's somewhere you want to be.
Awesome. Thank you, Josh, and welcome. And yeah, as I said at the start, great diversity in our presenters today. I found it quite interesting. You both started in the business space, Kerri, back in your receptionist days, and quickly gravitated into what clearly is a bit of a passion calling for you both. So thank you for sharing, and looking forward to hearing more from you. Look, I'm going to plant the seed a little bit here, an opportunity for your own reflection. And what I was going to ask you, most of you would have seen this, I call it the jelly bean chart, the graduate attributes. So these are the identified attributes and skills that you need to be successful as a graduate. And these are built into your learning contract. We align all of our curriculum to this, and this is normed from the industry and our 150 plus partners. So I want you to look at the 30 there, but in particular the 6 across the top. And I'm really keen for you to go with your gut here. And I'm going to run a quick poll. What do you identify as your biggest strength within these attributes? So do you feel that you're a really strong leader? are you really strong with delivering results and meeting those expectations? Is relationships and teamwork your biggest strength? So I'm just going to launch the poll now, and essentially you just pick one and go with your gut here, don't overthink it, and we'll get a bit of a gauge of the strength across the room. Relationships looks like a bit of a front runner so far. Can we have a second charge from someone else? Cool, well, we'll let those last couple trickle in. Seems like we've got a couple of standouts. I'm going to ask you, Kerri, because you've seen interns come through and you've reflected on your own strength. So a two-pronged question, perhaps what has been your biggest strength in the health sector and something you've always aimed to leverage off? And, from what you've seen and, your journey, what do you think is, something that maybe is missing or something you suggest students really get strong at to be successful? So your biggest strength across your career, and what do you recommend students focus on out of these 6 across the top here?
It's pretty hard to work out, I think, which one to identify as the strongest. For me personally, and being grounded in my identity, relationships for me is really critical, particularly when we work in the health sector. Relationships is about not only with our own mob, but it's also those cross-cultural relationships. And I think, we'll probably dive into the barriers a bit later, I know, but I think given that some of those cross-cultural differences that we can quite often have, takes a lot of time to break down those, some of those barriers. So for me, it's really important to start out building the foundations of good partnerships, good relationships with people. Clearly, you can't do that alone. You do need to have that collaborative, working partnership. So I guess that's probably the main strength for me. I also think, that personal leadership is really important. I think from my experience working at St John of God's, many of the students that came through showed really strong and great initiative. And I think that's something that, is really critical and important in the health sector, given the level of, of time poor, that we have been, particularly with practitioners, given the level of complexities from patients. So good initiative, good problem solving skills is really important. So I can't really stress enough around that as well. Awesome.
And I'm going to flip the question a little bit for you, Josh, and feel free to share as much intimate detail as you're comfortable. But, very competitive process that you've obviously been successful in and getting into that graduate role. I'm wondering, in your application and in your interview journey to get that position, what did you really celebrate and really leverage off in, I guess, your personal pitch for why you would be fantastic as that role, as the graduate doctor at Melbourne? What did you kind of, lean in your application and your process to make it clear that you're a gun?
Well, I think it comes back to a lot of the things on these graduate attribute charts. Like when you look at this chart, the things in the red, yellow and black are sort of what a lot of employers will kind of expect of you as a minimum, both when you start work and when you're doing your internships. Like they'll expect you to meet their expectations, be able to work in a team and communicate. And I think something that the Career Tracker internships are really good at is building up your skills across those 3. And you might be thinking, maybe your internship is a little bit different to your dream job or where you want to work after graduation. But wherever you are and whatever you're doing, you're in a professional workplace learning those soft, broad skills, which will put you in a good position to succeed. And something that I didn't really realize until I guess some of my friends were applying for graduate positions is that often we've gone through interview prep and we've practiced being interviewed in professional environments, and that's something through repetition, practice, and through the coaching that your student advisors give you that really give you a good edge. I think the green and the blue, the personal leadership and self-actualization, is what makes you stand out as a star, and sort of what makes you get ahead. And then when I look at culture and community, I think that's what gives your work meaning and what makes you happy and what makes you feel empowered at the end of the day. Is, are you doing work that's in line with your values, and are you empowering others, and do you feel empowered yourself to help your community and the communities of others? So what was your specific question? Was there anything?
That was spot on.
I think a lot of employers in any field really appreciate that combination.
Yeah. And something I've noticed, we've got some students now applying for grad roles, is actually the ability to talk in this language as well. I identified that my personal leadership was not a strength of mine. So I put in place with my manager and my advisor a plan to really improve in that area. And from there, I was able to increase my problem solving, but also taking responsibility for key actions. So I think having that framework there and looking at this as a strength-based approach, but also what do I need to improve on, you can very carefully plan out your targeted development and then tell that part of your story in your interview. Employers love it that you can reflect. They love it that you've got areas of improvement, but you've done something about it. But yeah, the relationships that you've both said, in my mind, and that ability to navigate different people in different backgrounds in different workplaces is usually what sets people apart, from having a happy, successful career, in my experience. Okay, so keep that in your mind. Going to sort of throw this open to Kerri and Josh, and Kerri, I'll start with you. Look, and it's a little bit of a no-brainer, but keen to hear from your own experience. Why is the health sector, what would society be like without the health sector? Why is it important, and why is it in particular important to Indigenous communities?
For sure, good question. It is important because if it's not, if we didn't have these professions, we would be building hospitals as quick as we're building prisons, which is really quite sad. I think, over the years, as we know how important closing the gap is, how much more we as Aboriginal people are much higher at risk of, getting chronic disease. But when I think about my experience in the hospital, with patients coming in for appointments, whatever it might be, whether it was through ED or whether it was through as an outpatient, I think the important thing is that health literacy. So we as health professionals, it's not about just going in there and doing the work that we are employed to do, but it's also about empowering people. It's about self-determination and empowering people to take responsibility for their own health. Because if we're about closing the gap, we can't forget, all of that stuff going on as well. If we want people to stop accessing ED, if we want people to be more, attending their outpatient appointments more, we need to be thinking a little bit more outside that box rather than just doing the job we're there to do.
Yeah, definitely. And Josh, I'm quite interested to get your thoughts on this, because you've obviously come in to a time where the health system has had to almost adapt to manage the challenges. But I'm curious to know, you're very early in your career, but where can you see the future of the health profession heading? Have you seen, technology changes overnight with COVID? Has there been a different kind of appetite for innovation, or is it, just doing the usual 9-to-5 health grunt work and just managing? Where do you think this is going to go? Are you going to be telling a very different story in 10 years about your journey? What are your thoughts?
Well, yeah, it's interesting. I think business can learn a lot from health and hospitals, and I think health and hospitals can learn a lot from business. I think I'm not sure exactly what it is, whether it's something that's intrinsic to hospitals, because there are plenty of large private sector organisations that have large bureaucracies but are still pretty nimble. But hospitals can be a little bit slow, to adapt and innovate. So we're only rolling out an electronic medical record system now in August in 2020. So at the moment, all of my notes are written down with pen and paper at work, and then they get scanned into a central system when a patient goes home, which you'd think is pretty crazy that would have been something that would have happened maybe 25 years ago. So I think, and this is where you should never underestimate your value. When you're starting your career, you might be young, but eventually you're going to be the leaders, and you're going to have you're going to see things differently to how people who have been in the field for a while see them. And so you shouldn't underestimate the contribution you have and the ideas you have. So I think increased kind of that move away from pen and paper to electronic stuff, which is more playing catch up. I mean, look, I think the rise, once you get AI systems that are affordable and reliable, I think there's probably applications that we can't even dream about yet that will sort of be a reality in the near future. Even things like being able to scan an X-ray or an image, like if you can develop a computer program that can figure out how to scan an image better than the human eye, that'd be amazing. And I think it's not so much just purely automation. I think people think of AI and robots as maybe something that will just affect blue collar jobs like car manufacturing industries, but I think it's going to revolutionize that kind of white collar workplaces as well. I think you'll always need humans to offer that empathy and understanding. I think we're an extremely not in our lifetime going to be happy with having a robot leading a research team or looking after you in a hospital. So I think there'll always be a role to play for humans. Yeah.
I hope so. I've had too many surgeries in my time. I don't know how I'd feel looking up at a robot telling me that they're going to cut open my arm. So yeah, no, look, really interesting, and we're in flux in a co-working space in the CBD, and some of the founding partners of Health Engine, I don't know if you guys have seen that app, but it's basically the biggest universal nationwide GP booking service. And so there's been a real niche into that market where, they're now getting significant investment to just book an appointment to see a doctor. So elements like that sit outside, and the health sector management, areas are going to pop up as well. So keen to hear from you both, and I'll ask Kerri first, and really interesting in your kind of journey, Kerri, to now be in that consulting space, which is exciting. But what's at the core of you? Why is this your profession? Why did you ditch the exciting business career and go down this line? Why are you now in this space, just trying to give back and engage and help others and other organisations? What motivates you within this profession?
I think it's probably, we see too many of our people dying so young. And again, it goes back to getting that good start in life. They say the first 1,000 days is absolutely critical. And after seeing, so much heartache within your own kinships, within your community, it's bread and butter for me. I just think that continuously keeps me motivated. I'm very passionate to build people's capacity and capability around that, as I mentioned, the self-determination stuff. But, I think the number of different roles, the number of different settings that I've worked in, and what you sort of experience and overcome, it only makes you stronger and more motivated, I guess, to keep plugging away at the status quo. But I think, we've all got to collectively come together, because in order to change that status quo, if we don't all collectively come together and, ensure that our voices are being heard, ensure that we can get that leadership at that very high level to make change, nothing will change. It'll just remain the same and things will just continue as is. So yeah, there's lots of different things that I look at, that I reflect on in my life. And I think, now that I have grandchildren, grannies coming through, I want them to have the best possible life, that I can offer, and I can support my daughter and my son-in-law around giving them.
Awesome. That's great. And what about you, Josh? What's at the core of it for you?
Yeah, I think for me it relates sort of to that first point, where it doesn't really matter if you're working sort of at a hospital, in government, and private sector, at a research institute. Health is something that touches everyone, and it's a great democratizer as well, because it doesn't really matter if you're a top surgeon or you're homeless sleeping rough. When you're sick, you're in a bad place and you need help, and it's an honour to be in a privileged position where you get to help people through that. And I'm also excited, as Kerri was saying, about contributing to change. I spent a month at an AMS in Cairns a couple of years ago. And that was just a really inspiring month, because you had sort of this great facility with Aboriginal health workers, a dentist, diabetes educators, physios, psychologists, GPs, all under the one roof. They had a little minivan to pick up community members to bring them to their appointments, and it's a one-stop shop. You don't have to go to 5 different places over a month. You can just go to one spot. And I really liked seeing that kind of positive community-led solution run by community for community. And so yeah, there's a lot of exciting things happening that give me a lot of hope for the future.
Awesome, thank you. So look, lots of challenges in life and in the workforce, and sometimes we can be our own barrier to success. But I'm going to ask you both, and just want a real short, sharp answer in this space. So in terms of navigating the barriers for success in a career in the health industry, what's your go-to tip for things that are inside your control, so that you can actually have some influence on, and maybe are more personal? And how do you rise above that or deal with that internal conflict? But then secondary, the barriers that are outside of your control. So the system, the policy, the paperwork, that can cause you to quit real quick. So Kerri, things that are in your control, how do you work through that? What's your tip for that? And then things outside your control, and maybe there's some similarities there. What are your thoughts?
It's a hard one, that first one, navigating within my control. Strive for the moon, strive for the stars, be leaders in your own right. Because I think age and wisdom has certainly got me to where I am today, and I can't not ignore that. My mum always told me that, as I was growing up. And I know now, I'm my own boss, so I am within my own control. And I can now navigate those barriers in a much more healthier way, where I don't get myself into a position of stress and worry and you start pulling your hair out. When we are working for the big organisations, we are constantly under those, organisation pressures, as workforce loads, increased workloads, burden of policies and practices. You're governed by accreditation standards. So those things, are not within your control. One thing that my mum always taught me is don't ever stress over anything that's out of your control, because there's nothing you can do about it. Yeah. So I think being strong within your own self helps you, I believe, will bring out those attributes a lot more easier. And they're really good attributes. So I can't stress enough to really hone in on those and leverage on those and build on those existing strengths that I'm sure you all have.
Yeah, awesome. Look, I'm going to keep us moving, and we might come back to some elements of this. No need to apologise. That's spot on. I guess I want to shift, and this may be in the face of that barriers to success. Ingredients for excellence. So I'm going to ask the audience to think about a standout person in the health sector that you've experienced or you've worked with or you've seen. Could be a family member, could be a colleague, could be from your internship, could be a doctor that you see down the shops. What characteristics do they have that makes them a standout? And you can come back to the graduate attributes. And really keen just to capture a couple of those characteristics in the chat right now. So have a bit of a reflection. What do they do well? What's that characteristic? Are they good communicators? Are they honest? Do they listen? Do they lead? Just going to give the audience a couple of minutes now. Start typing in the group chat characteristics for excellence that you've observed or you've experienced in the health sector. Oh, another good West Australian there, Tracy. But what is it about Tracy Westerman? What's her key element that makes her a success? While we're capturing a couple comments from the audience of these characteristics, what have you noticed, Josh, in your first 6 months within your team or within the leadership of that really great operator? What has been their number one ingredient for excellence that you've observed that maybe you're going to try and mirror? What have you seen so far?
I mean, I think the things that we recognise as excellence tend to be the things that are a little bit rare. I mean, if everyone's doing something, we don't tend to mark that as, well, that makes that person stand out. I mean, something for me that I've really appreciated or thought was great was when health professionals took the time to actually break things down into simple terms and was a good communicator and explained to the patient, what was going on, the cause of their symptoms, what we were doing. You'd think that's incredibly basic. not a lot of doctors will take that kind of 30 to 60 seconds to just close that communication gap and make sure that they're aware of what's going on. And it's something that's super simple, but because it's rare, that's something that stood out to me. And the kind of best people that I've really admired have been the ones who, yes, they're gunners and they're great at their job, etc., but they take that extra little bit of time to make sure that, the person who's sick in bed is on board with what's happening and knows what's going on.
Yeah, fantastic. And that comes back to that relationships piece that we were talking about earlier, and the ability to, that listen, that extra comment, that extra thought, and then that message to, family or the staff, or to join those dots and connect that communication. I encourage you to have a quick look at the chat. There's some really good answers there and some different perspectives. I'm going to keep us moving because we want to shift this lens to what can you do? So we've heard some good messages today. We've heard some different experiences, some different learning journeys. And I'm going to break this down into the Career Trackers community. And then I'm going to set you up to do a little bit of your own thinking. So Josh, in terms of accelerating your success, and you can think about the bigger picture goals of the Career Trackers program, which sits under these 3 pillars, what's your advice for our audience today to accelerate that success? We've got to get that piece of paper, we've got to get that qualification, we've got to get a seat at the table with this professional degree, but that comes back to, doing well at the university level. Well, what's your advice around students in our program accelerating their success and doing well on the university pillar?
Sorry, I didn't unmute. So, I mean, you've got to, be doing okay academically, and, I think things like time management were a big one for me, just in terms of prioritizing what I needed to do today and what could wait till tomorrow, and then also just finding a good place to study. I became a big fan of one of the libraries on campus just because that was somewhere that was open 24/7. I could go there and work, and then when I was at home, I could just relax, was something I found really helpful. And then I think secondly, universities are just these amazing hubs where there's so many things going on that you can get involved with. And I'd strongly recommend, while you're at uni, don't think of it as just a place to get your qualification and move on. Try and soak up everything else that's happening and get involved in some societies. Like I mentioned the Indigenous Collective earlier, but there's so much else going on as well. And employers really appreciate if you've got some interests outside of just your work and what you're studying. I guess the other big thing is I'd recommend, running for something, getting on a committee if you're really interested in, most unis will have a Disney society or something, become the social convener for that, because it gives you a lot of, broad skills and event management, communication, working with a team, even if you kind of all have your different quirks and things like that. So if you're not already, I know a lot of you, there's already a lot of impressive people in the Career Trackers community that do that sort of stuff. But if you're not doing that kind of stuff, I'd definitely recommend.
Awesome. And Kerri, you've seen, a couple of interns come through the program. And let's say, for example, we've got a returning intern and, they've had a pretty good first internship. What could they do that's practical to demonstrate that stepping up, but also put themselves into situations which will challenge them and enable them to learn? What's your advice for that success acceleration within the internship?
Yep. I think, stay confident within your own self to be, to be able to be proactive in that space, again, in the hospital. Keep on using that initiative, keep touching in on other people other than being comfortable, where you might be well placed. But really, leverage off others, learn from others as well. And don't be afraid to ask questions. Don't be afraid or be shame or anything like that. Have a voice. Make sure your voice is being heard. And if you feel as though, there's barriers there, ensure that you talk about that and look for solutions, I guess, to always overcome those barriers. But remain self-confident as well.
Fantastic. I'm going to give a prompt for the community pillar, and that's really with a focus of the Career Trackers community. What I love seeing with our St John of God partnership, we had 3 or 4 WA interns across 2 or 3 different hospitals, and whilst they may have known each other outside of that, some of them became new friends, but also now you've got a really good colleague at a great hospital down the road. So I love that element of building that network, but also the networks within hospitals. Tian and April know Kerri Colgate. They've got a cousin or a family member who is joining the program and looking for their first internship. Kerri would be more than happy to have a yarn with them and share her story. So linking and leveraging off that network is essential. So guys, we've got about 7 or 8 more minutes, and I just want to bring us to a real focus as we come to the end. I want you to reflect and think about what we've done and talked about today, the key points from Kerri and Josh, but I want you to bring this to yourself now. And I want you to think about how can I accelerate my own success, whether it's uni, internship, the community, a particular skill or attribute. And I want you to decide one simple action that you can take this week, next week, in the next month, not too far down the track. And I'm going to put you into a breakout room now. Make sure you unmute yourself, because otherwise you'll be talking to no one. I want you to keep it really short and sharp, because there's about 3 minutes in the breakout room with 1 or 2 more people. What's one action you can take and you can commit to doing that will accelerate your success? I will see you in 3 minutes. Save the formal instructions with your new buddies in the breakout room. Just get into it. Good luck. Off you go.
Sorry, Phil, you didn't want me to join, right?
Are you in one?
No, do you want me to?
Yeah, do you have that functionality?
Yeah.
Yeah, jump in once, just have a listen. Same with you, Kerri. 5, 4, 3, 2, 1. Okay, we are almost all back, just waiting for a couple more to come. Hopefully the group will kick everyone out. 10 seconds.
April's cut her hair off. I'm just looking at her.
Yeah, she did. We actually watched it. It was amazing.
Oh, really?
I did the greatest shave.
Good on you.
Going back. Guys, coming to the close here. Thank you everyone for today. Look, a huge thank you to Kerri and Josh, our speakers. Career Trackers will release this as a resource as well, so if you want to go back over it, there's a link there for some feedback, so please action that. We're really keen to hear your thoughts. Before we close, I'm going to put it to Kerri and Josh for their 10-second final word of wisdom. So if you're a Career Trackers student or an intern, Kerri, what is your last piece of advice? You got 10 seconds, and then we'll hand over to Josh, and then I'll wrap up.
4 words, I had it written down. Celebrate survival, the importance of us all still being here.
Awesome, thank you. And Josh?
Don't stress, enjoy the ride.
Yeah.
Oh, you two could go into the bumper sticker business with that. That's fantastic. Fantastic. Really appreciate it, Kerri. Really appreciate it, Josh. Good luck for all of our students and participants for semester 2. Hope today's been of value, and yeah, try and take some of the learnings and your action that you decided on into semester 2. Have a great day and stay safe as well.
Good luck,
Cheers.
everyone.
See ya.